Welcome to our webinar, Supporting the Immigrant Community During the COVID-19 Pandemic. Today, we are happy to introduce our speakers today. So I'll go ahead and have our DFC member, Amanda, introduce everyone.
Hi, everyone. Thank you for joining. We're excited for this webinar today. We have some great speakers. We want to focus on both informing you guys of how this pandemic is specifically affecting the immigrant community, but also give everyone some real resources and information on how we can support the immigrant community during this time. So today we have three speakers who are going to present to you. We'll start with Katie Atkis, who is the Disaster Resiliency Manager for the Houston Immigration Legal Services Collaborative. And there she manages two projects, the Humanitarian Action Plan, where she coordinates disaster response and recovery for undocumented folks, and AccessHU, which is a social services database and website to help their advocates locate safe, secure social services for their clients. So Katie, if you're ready, we'll go ahead and start.
I am ready, and I apologize. I'm not seeing how to share my screen. Can you hear me?
Yes.
Hi, this is Jorge. I'll be here for tech support, so I'll be able to give you access to the presenter. You have to give me a few seconds. Do you see the access now?
Yes.
So you should be able to share your screen.
Okay. Excellent. You can see me now?
Yes, it's perfect.
Okay. Excellent. Sorry about the delay. So I'm Katie Atkis. I'm with the Houston Immigration Legal Services Collaborative, and I'm the Disaster Resiliency Manager. So I've been working with HILSC since post-Harvey to basically try to make sense of the chaos during Harvey and put together a plan based on our response and what we learned from it in order to ensure that immigrants are more resilient in the future. So Amanda mentioned AccessHU. So accesshu.org is a database that is resources by and for immigrant advocates. So when I say that, what I mean is that we have 4 partner organizations that provided their referral list that they're using daily for their immigrant clients. We put them into this database and it's now publicly available. The other thing is that it's open source, so anyone can make changes. You'll see that yellow bar across the top. This means it's an emergency mode, which means we don't want to be a bottleneck for information, which changes so quickly in emergencies. And so the quality control mechanism is dropped while it's in emergency mode. So any changes that you make will go directly into the database. So if you work with programs, I encourage you to please go in, see if they're there, update them with the most recent information based on service changes from COVID-19. But also, if you're looking for resources, you can certainly check out AccessHU. It may seem a little redundant of 211, but the way it is different is that we were asked by our members to put together something that had data fields that were more specific to immigrants than what they could find with the United Way system, and help them make better referrals. So we've built it out, we've put in basic information, and now we're asking you to go in and update it with the remaining information that you know of, either for your own agency or for other agencies and programs. Another resource that we have, AccessHU, is for direct services. They're for things that are ongoing, not one-time relief, but ongoing services. So the other thing that we have that captures resources that aren't in AccessHU is the COVID-19 resource guide, and you can find the link there. And we also have an immigrant rights hotline, which has operators from 3 of our partner agencies. It operates Monday through Friday, 9 to 5. And they're drawing on both the resource list and Access You to answer questions and also making referrals for people. So I set this up in kind of a Q&A because we do not provide any direct services. We are a collaborative of member organizations that provide services. So the work that we do is always in response to our members to help them provide better services to their clients. So these are some of the questions that we've heard a lot during COVID-19. So is there any local help for helping me pay rent? And there we go. Yes, there is. The Greater Houston Community Foundation actually announced their 3rd round of grants just today. If you are trying to help immigrants connect with resources, please have them call 211 immediately to get into the database if they're not already working with an organization. This money is going really, really quickly. You probably saw that the city of Houston put out a $15 million fund, and that was gone in 90 minutes. So there's a really high need for this, and so it's really important that you are moving really quickly in order to secure these resources. Harris County also voted on a $30 million fund. They're still working out the details of how that is going to be administered. We know Greater Houston Community Foundation will play a role. I believe the Community Services Department will play a role, but they'll be announcing details soon. So again, please keep your eye out. So then there's a lot of questions. There's a lot of fear of from immigrants around receiving services because they're afraid that is going to interfere with their ability to get a green card. So really what this is a public charge. And the important thing to know about public charge is that it's only applied at certain points along the immigration path. And even then, there may be exemptions. So examples of this are if you're a legal permanent resident and you want to become a naturalized citizen, or if you, let's say you're perfectly happy with your immigration status and then you marry someone who's a U.S. citizen, you want to get citizenship. So at these points of change in your immigration status, they look at whether or not you're a public charge. So the important thing to know about this is that it's not just looking at cash assistance or whether you're getting health care or not. It's a totality of circumstances that they take into consideration. So cash assistance comes into the category of income and assets. And all of these factors, again, are considered. So not just one is going to necessarily make or break your application. So what does fall under public charge? Generally, general cash assistance does. SNAP, Medicaid, with the exceptions that you see on the screen, Section 8 housing vouchers, project-based subsidies, and public housing. But it is important to know that anything that falls under disaster relief will not count towards public charge considerations. So since we're in a state of disaster currently, any relief that is obtained now, whether it's local or private or otherwise, will not be considered. So we're also getting a lot of questions about utility assistance. So the Texas Public Utility Commission has halted shutoffs until the governor's disaster declaration ends. But you can see it doesn't apply to natural gas. However, there are a lot of programs, relief programs that are happening that direct utility providers are giving. So if a client is looking for something, looking for relief, the best place to start is to call the electric company and see what kind of relief could be provided. There's also a low-income list that people can get on, which will suspend disconnections, but you must qualify for unemployment benefits in order to be eligible for this. So if you're undocumented, that would not work. There's also a whole slew of organizations that on an ongoing basis provide rent and utility assistance, and you can check Access to for those and access services through there. Is there assistance for the internet? Well, yes and no. There is some, but the participating providers that agreed to not disconnect phone or internet and waive late fees and provide free hotspots, the time, I believe, is up. I got a text today from Verizon saying that my extra 15 megabytes of data are now expired and we're back to normal. So there may be some help. You can go to that link, the Texas Law Help. That link is also on the resource list to find more resources. And then there's a lot of need for legal help. A lot of people are having issues with evictions or rent, coming up with payment plans with their landlords. And so there are a lot of organizations in town that provide help. Houston Volunteer Lawyers is a great place to start. University of Houston Immigration Law Clinic and South Texas College of Law. Those first three have no limitations on who they can serve. So it's a great place for undocumented people to go. The Earl Carl Institute at Texas Southern University and Lone Star Legal Aid only serves immigrants with lawful status or victims of domestic violence. So some clients may be eligible and there might be more space there, there might be more capacity, but there's a lot of services that are available. So here's another shot of the URLs for the resource list that I mentioned. And there's my information, Katie at HoustonImmigration.org. So if you're looking for information or if you're working on Access U and you want help figuring out how to make something happen, please go there or please email me and I'd be more than happy to help. Just to point out other things you can find on our resource list, there's a lot of information there about PEBT, who's eligible, how to get it. There are templates in multiple languages for agreements with a landlord on payment plans. There's a lot of resources that are out there that are being developed by people with expertise in these different areas. So we're trying to link to as many as possible, but the resource list is also, you can see it's a live list. So it's a Google Doc, and we put it in that format so that anyone could add resources, anyone could make changes. You can also go in and put in a question as a comment, and we can look into it to see if we can find the answer for you. So please use these resources. All of the data in there is only as good as the participants keep up and I work on. So, you know, jump in, help me out, share what you know, share what you have, and together we can make sure that immigrants have access to the resources that they need through this disaster and otherwise. Thank you.
Thank you so much. So now we'll move on to Dr. Ana Monterrey, and she is an assistant professor of pediatrics at Baylor College of Medicine. She works out of the Pasadena Pediatric and Adolescent Health Center, and she has special interest in underserved populations as well as immigrant health. And so she's going to give us more of a clinical perspective about what she's seeing and how she's able to support her patients during this time.
Hi everyone, so I'm trying to share my screen here, give permission. Let's see. Is that working? Can you guys see my screen? or no?
No, not yet. We can't see your screen. I shared access with you recently, so you should be able to see a notification.
Can we try again?
Sure, no problem.
I haven't gotten anything, Jorge.
I'm switching real quick, so give me about 10
Okay.
seconds.
Sorry about that.
Let me know if you see a notification.
I did. I clicked show my screen.
Here we go. That popped up.
All right, great. Well, let me see if I can make this bigger. Okay, hopefully that is on presentation mode now. All right, sorry about that. So yes, my name is Ana Monterrey and I'm a pediatrician at Baylor. So I wanted to talk a little bit today about some of the challenges that we're seeing from a healthcare perspective with our immigrant patients. Houston is home to 1.6 million immigrants, as you guys may know. And as a pediatrician, it's important for me to know that close to half of the children in Houston are first or second generation immigrants. So again, I'm going to touch on a few of the challenges and some of the ways that hopefully we can address these challenges and support our patients during COVID-19. So I work at the Harris Health Clinic, the Pasadena Pediatric Clinic specifically. The Harris Health System is one of our safety net clinics or safety net systems in the greater Houston area, and about half of the patients in the Harris Health System are uninsured. And that's important because we know that many of our immigrant families are uninsured. My clinic, about 25% of our patients are uninsured. About 68% of them are Hispanic, most of which are from Latin America. And about half of my patients speak a language other than English. We do take care of some African and Asian immigrant families, in addition to mostly Latin American immigrant families. So unfortunately, many of us are hearing that COVID is affecting our immigrant patients, racial and ethnic minority patients disproportionately. And this includes many of our immigrant families. The CDC reported that there are higher rates of hospitalization among Blacks and Hispanics. And there was an interesting viewpoint from the Journal of American Medical Association, JAMA, from the Bronx in New York City, which is a highly immigrant community, saying that they have some of the highest rates of COVID in New York City, and just talking about how affected their immigrant population has been because of many of these factors that apply to ethnic minorities, but also to our immigrants who are frequently living in houses with multiple generations in more densely populated areas where it's hard to social distance. They work jobs that are essential, like the service industry, like home health aides, where they have sometimes limited work leave and are more exposed than other occupations. Many of our racial and ethnic minorities have underlying health conditions as well that predispose them. And access to care, as we mentioned, higher rates of uninsurance means that families are not accessing the care that they need, or because of public charge, like we have discussed, some families are not accessing health insurance. So this is just a quick snapshot of, as of the 28th, our numbers. And I pulled this up specifically because I wanted to show this slide, which shows the numbers for Harris County by racial and ethnic background. And I thought it was striking to see how much higher our percents are for, our numbers are, our absolute numbers are for Hispanic and Latino families, many of which are immigrants. And unfortunately, when you look at who has died from COVID-19, our Hispanic and Black patients are among higher percentage as well. So Texas is already is the state with the highest number of uninsured patients. And now with COVID-19, the Episcopal Health Foundation estimates that 1.2 million Texans have lost their jobs. So that means we're going to have even more families who are uninsured, many of which are going to be our immigrant families who maybe did have insurance through jobs, or who maybe previously did not qualify for public health insurance, but now because of loss of income may qualify for public health insurance options. I'd like to talk a little bit as well about just general access to healthcare and navigating the system, because this is definitely a challenge that we see for many of our immigrant population, especially in my clinic. So our families struggle with making phone calls to schedule appointments, frequently because of language barriers and just not understanding the way that our healthcare system works. And so in situations like we're having now with coronavirus, where it's even more important for families to be connected to care, it's extremely important for us to be supporting these families and potentially taking an extra step to help them navigate the system and ensure that they are able to access care. A lot of the clinics have changed their hours. I know that we are still open the same hours, but we've changed sort of the types of patients that we're seeing in person versus via telemedicine. Families may think that our clinics are closed and not accessing care, so making sure that we are providing appropriate messaging about the fact that we are still here to provide care, I think is important. Telemedicine is interesting because telemedicine gives us the opportunity potentially to reach a wider set of patients than we would have just from a geographic standpoint. Many of our immigrant families have difficulty with transportation, and so the ability to potentially do an appointment via video or over the phone could potentially alleviate that barrier, but it brings up some of the other barriers that we're seeing as well, and that I think Katie mentioned, things like access to Wi-Fi and the internet. Some of our families may not have smartphones with working cameras. The platforms that we're using for telemedicine are mostly in English, so making sure that we're really talking our families who speak other languages through the process ahead of time so that they understand how to get through it is going to be important so that they can also obtain these benefits of telemedicine as a modality. The other thing that I'll add just from a providing healthcare standpoint is we know that bias and language barriers and cultural competency can play a big role in how we provide healthcare. And our immigrant patients who are going to participate in telehealth, that may be potentially even more pronounced. And so we need to make sure as providers that we're thinking about that and that we're taking it into account when we're providing care virtually, even more so potentially than when we're providing care face-to-face. I think Houston's done a really good job of sort of public messaging regarding coronavirus. We've seen plenty of information out there in both English and in Spanish, and I liked this little snapshot from HoustonEmergency.org, which has a lot of other languages listed as well, so that we make sure that we're reaching a wide population. But even still, we have patients who are receiving this information, and we have families who are afraid. I had a parent on a telephone visit a few weeks ago who told me she was terrified of leaving her house, and her infant who needed formula. she didn't even feel comfortable going to buy formula for the baby. So she was giving the baby cow's milk, which is not appropriate. But it gave us the opportunity to really understand where some of our patients are coming from, and the opportunity to provide reassurance, to talk about safe ways to go out, and just take that extra time to really check in with your patients, to ask questions about how they're doing, what they know, and be there as a positive and reassuring influence as a healthcare provider. I'd like to touch briefly as well on food insecurity, because this is going to be a big issue for many of our families as we move forward, especially our immigrant families. This table, or this figure, is from a Feeding America report talking about the impact of food insecurity. And you can see that they broke down food insecurity rates by occupation. And you can see that many of the occupations that our immigrant families hold are falling into these higher rates of food insecurity. So this is definitely going to be an issue that we're going to see in the general population, but potentially even more so in our immigrant families. Unfortunately, Texas is amongst the projected higher rates of food insecurity in general as a state. And just when you're looking at sheer numbers of food insecurity, Harris County is amongst the higher numbers of people with food insecurity. So definitely something that our community needs to be addressing and that we can talk about as healthcare providers. So the first thing that we can be doing is we can ask. So we can be screening our patients for food insecurity. So the Hunger Vital Sign is a validated questionnaire to screen for food insecurity, and it is available in multiple languages, including English, obviously, Spanish, Vietnamese, Arabic, amongst several other languages. So we can use that as a screener to find out if our families need help with getting food. Additionally, we can, for our practices and for our clinics and our hospitals, implement food insecurity screening more widely. And there are tools out there like the Texas Children's Food Insecurity Screening Toolkit that's specifically for Harris County. Mental Health America also, Feeding America also has a food insecurity toolkit for physicians and organizations to help guide providers. And we have a lot of excellent resources in our community right here, including the Houston Food Bank, that's doing so much work around addressing food insecurity for our patients in general. And so this is the Houston Food Bank hotline card that you can direct families to this phone number to help them not just determine if they can get food stamps or not, but find a local pantry and other programs that are offering food in the community. There are other organizations like Kids Meals and Interfaith Ministries Meals on Wheels program that are still working even during the coronavirus, and they're going out into the community and providing food to seniors and to young children. I'll talk a little bit about SNAP here. Some of our families will qualify for SNAP, the Supplemental Nutrition Assistance Program, or formerly known as food stamps. I think we need to be sensitive because of public charge and understanding that some of our families may not want to apply so that they don't, it doesn't interfere with them obtaining their legal status. And so we just need to be sensitive that that may not be something that families want to enroll in. But for those who do feel comfortable enrolling their U.S. citizen children in SNAP, the Houston Food Bank can help us do that as well. And really, I think in general, advocating for policies that include our immigrant families when it comes to providing food assistance in general. I want to touch briefly on a few things that are happening through the Harris Health System. Like we said, Harris Health provides a lot of care to immigrant patients in our community. And they have a couple of great programs where they're addressing food insecurity, like the food pharmacy program over at Strawberry that's enrolling patients who have diabetes and also have food insecurity and providing them with produce every 2 weeks along with nutrition education. And they've modified how they're doing their program right now during coronavirus, but they're still going. And that's a great resource if your families potentially live in the Pasadena area. The LBJ Hospital has a farm on their campus as well that they are hoping that their produce will feed their own food prescription program. And my clinic specifically, we are partnering with the food bank to provide direct assistance to our patients who do decide that they want to enroll in SNAP. And a coordinator from the Houston Food Bank will work with our families one-on-one to ensure that they're able to complete their SNAP application and get that submitted. So that definitely helps our families who have limited health literacy or even have limited literacy in general and language barriers, because we have a Spanish-speaking coordinator as well who can work with them through this process. So lastly, I just want to say we know that our immigrants are especially vulnerable. We can be advocates individually when we are seeing our patients and asking them how are they doing, what do they need, connecting them to the resources that we've discussed, like food insecurity resources, but also some of the things that Katie mentioned previously as well. And we definitely can be a positive voice in sort of reassuring our patients and providing, I think, the right information that they need to hear right now during the coronavirus. Thank you.
Thanks so much. So finally, we'll move on to Sarah Howell. She is the social worker at Las Americas Newcomer School, which serves the recent immigrant and refugee population here in Houston. She also manages the social work department at Houston Revision and is the founder of Star Counseling and Consultation. She has built her career working with immigrants and refugees and specializes in trauma and torture survivors within those populations. So we're excited to hear from her.
Thank you. Are you able to see my screen yet?
Yes.
Yes, everything is done.
Okay, so I appreciate the introduction because you just saved me some time. I actually, when I was thinking about this, I kind of backed up and I've gotten more involved with Revision during COVID. I had stepped back for a little while, but I wanted to back up and share the two different perspectives of what I'm seeing from the immigrant community, both at the school, the work I'm doing there, and then from the community organization side with Revision. And I was going to share a little bit about, well, what each one is doing and kind of the barriers, the successes, and what we've learned from both. So at the school, my focus, so on my campus, Las Americas Newcomer School is part of HISD. We're a public school, and with that, or as part of a HISD school, we now this year have a wraparound service specialist. So my role as social worker has gotten to shift a little bit more back to mental health, the clinical side, as well as administrative work. So when I'm talking about services we're providing, we also have our wraparound service specialist that's really connecting with a lot of the basic food resources, navigating the day-to-day questions. But I take on the complicated ones that need a little more assistance, but disseminating information to the whole school, something she takes care of. So the current things that I'm focused on are social emotional work, teaching about those life skills, mental health, checking in with students, meeting basic needs. But again, I work on the more complicated cases. So that's, I guess, what I'm focused on there. Our school is, like the rest of the HISD schools, technology-based. And I guess for those of you who don't know, we were over our capacity. We're about 375 kids this year. We take the newest of the new immigrant kids who've just crossed the border. Traditionally, we had a higher number of resettled refugees. Since the surge in 2014, we have been about between 80 and 90% Central American, Northern Triangle, so Honduras, El Salvador, and Guatemala. And we keep kids for just 1 year, depending what time they enroll in the school year, maybe it's less than a year. So it has been a very interesting transition to virtual learning, but like the rest of the HISD schools, we have been 100% virtual technology based. The obvious barriers, of course, is technology access. And I don't speak great Spanish, but function in Spanish, and language has been an incredible barrier for teaching English online. I know that my friends in Guatemala often teach online Spanish classes, so I know it is possible to teach a language class online, but it has been really difficult. Starting with knowing how to use the computer. I'll share in a moment kind of the steps we took, but we started out by having to scale back and do a really, really basic survey, and I've screenshotted a few of the results. You can see 84% of our families, when we did an initial screen survey tool, did not have access to a computer. Almost 90% are working from a cell phone. It has been adequate because our kids are not writing papers, but if you think about the access to fill out applications, we do a lot from our phones, but you don't think about going to school from your phone. So having access to a device, and when we're looking at families that have multiple children, often they're sharing one phone through with 3 or 4 kids in the household, including it's the phone that mom or dad might use when they go to work. The other thing about technology access that I made a mistake when we were first trying to reach out and kind of get a sense of what our kids needed was we assessed whether they had access to a cell phone, and we were doing this at the end of March, and then people couldn't pay their phone for April. So it was both physically having the device in order to connect with, get news, get anything kids needed, find out where food distributions were happening, call, schedule an appointment, find out where to make an appointment, but also being able to have that have the internet connection or anything else. Something else we learned in the process was that a lot of people answered that they had internet access because they were accustomed to connecting to Wi-Fi at McDonald's, at the school, and it wasn't something that they actually had in their home. So, and off the bat, trying to connect families to meet their needs, whether to share medical information, whether to share, just basic COVID information, totally dependent on whether or not we could access them. And then I'd say once the shine wore off, a week or so in, we started really seeing the motivation from kids. The same kids that tended to find a reason to leave class found a reason to leave the virtual class as well. And believe it or not, we had some challenging kiddos off the bat who were, wanted to pop in and out and mute their teachers. So there were some challenges to virtual education on that side. From the community side, with revision, we focus on at-risk youth, particularly youth that are involved in the juvenile justice system, and I pick up the immigrant kids in particular who are involved in the juvenile justice system. Revision, I've been working on their side where we have after school programs, community programs. Once COVID hit, we really moved to their focus shifted to food distribution and meeting the most basic needs and making sure we're continuing to connect with youth. Also so the information can be disseminated. And we have handed out a heck of a lot of condoms in the process. And today, pregnancy tests, so condoms didn't always work. Barriers to revision reaching out and connecting with kids is that the population is incredibly transient, and the kids are popping from one house to the next. The first few days, I say the first week or so, kids were doing a pretty good job at staying home, and then they were restless and started, find them on the street just like we did before. And over at friends' houses, same thing with technology access. There is not enough and phone bills aren't able to be paid. Motivation, a lot of our kids were not regularly attending school, and it's hard to connect when you don't have a network. So all of the schoolwork, I've been able to get information about, rental assistance, about where to find food, about how to get to the doctor when they're connected through the school, when I can blast something out. It doesn't work when they're not signing in. Same thing with revision. It makes it really hard to do anything through technology. And so for revision, the food routes, when we're actually going out and delivering a meal prepared by a chef, we're getting to connect with kids. I have not gone out for many school visits. I have been going out for revision 2 to 3 times a week to actually see kids face to face with a significant distance, with a mask, and it really makes a big difference in order to be able to connect in person. And now kids are just tired of it. They're also starting, the families, they're not following the news that you and I are. They're not necessarily following how many days the rate has been dropping, and they don't get it, and they're just annoyed and ready for things to go back to quote unquote normal. So when I was thinking about what to share with you guys, I really wanted to take it from the aspect of like what's worked and how to connect and how to serve the community when the traditional ways aren't working, or when we're not able to sit in a traditional setting, and especially this immigrant community. So the language has been a barrier because I can't act things out. Right now I keep using my hands and you can't see me if I'm showing you my information. Because we have a low literacy rate in both communities, the school community and the community organization side, we have found that doing surveys administered by staff has been our most successful attempt. Also, I've quickly learned that when I do a survey, I get different results than my colleague who just flies through the questions. So, the social worker and me can go a little bit more in depth and ask some, broad a little bit more. But if someone is asking questions who just flies through it, it's going to be pretty surface level. That also comes to the part of it, knowing the situation, knowing your clients, knowing those fears and those concerns that the previous speakers discussed about, and being knowledgeable of what's accessible to them makes a really big difference. But if I was to sit down and call a family just because I spoke Spanish and didn't know the ins and outs of what it might be like being a Guatemalan family that had just arrived and what questions they might have, then I wouldn't get nearly as far. So we're having to ask creative questions, and we're having to elicit the basics. So that was the point of wanting to share this technology access, these first couple of questions. When HISD tried to find out what families needed and how to reach families, they sent out like 4 questions that people could not read. We got 3 surveys back from just the automated one that went out. The questions were more complicated and didn't dig a little bit deeper. And so that's where we had to really back up. So if you're trying to see how you can support a family, you need to go back to the most basics and not jump right to, can you log on to it's not, can you access the program, or can you get I think about all of the medical results I have to get online to access. If you can't read the text messages, or you learn that you need to, relay things through a voice message, then you're not going to be able to take the next step. Our families, I'm finding, are not familiar with how to sign into different programs. So having the device, having the connection, knowing how to use the basic applications are the first steps, and needing to elicit some of that information. And then asking again, because I've found over and over, I have not gotten to do the level of mental health work I anticipated doing for the school, because when I ask, everything's fine, everything's fine, everything's fine. And we all know it's not. It's finding, again, a creative way to ask the question, or maybe really specific, and then having to come at it from different angles. In addition, it's been really helpful to have multiple access points on our school campus. For instance, kids can reach out to me as a social worker. They can reach me on my work cell phone. They can reach me through our school system. We've had the school number transferred to the secretary's cell phone, so they can call the main school number. There's instructions posted at the school on how to call the main school number if you need. You can ask any of your teachers and they get the information to myself or the wraparound service person. So there's all of these different people that will direct you back to a home base. In addition, when we send out things like food distribution, or when we were doing rental assistance, when we were helping families connect with the Baker Ripley Rental Assistance Program, so through the City of Houston, we did a question and answer webinar, and then we were up early helping people get in the queue and apply. But having it come from their teachers, come from us, all these different people repeating the same information. Consistency in the midst of inconsistencies, in a time where I'm able to tell the kids when I'm seeing kids on a revision route, I can tell them I will be back again this week. It's not always, I don't always show up at exactly the same time, and I don't go every day. Somebody will always bring food. It may or may not be me, but I'm able to tell them that. So I don't know when we're going back to school. No, there's so much I can't answer, but having something I can consistently respond to and that we can be consistent with has been really important. And being really transparent. When I train teachers, I talk a lot about how important it is to model the behavior you want and being transparent and just telling kids, I don't know. I don't know the answer to that. When I know more, I'll tell you. But both the revision families and the Las Americas families, just being really honest about my limits and what I am and I'm not aware of. Being accessible and knowledgeable. I have had to push my limits of what I'm comfortable with as a clinician, as a social worker, with using social media. I have separate accounts that I use. I have a separate school number, work number that I use for WhatsApp. These are not with the ethics that I was trained in graduate school. And I'm very careful to make sure it aligns within the social work, NESW code of social work ethics, but it is pushing my comfort level. And it's all about finding creative ways to make sure we can connect. And for instance, I will reach out to a kid and confirm that they're safe. We'll do a basic like heart rating, 0 to 10. How are you feeling? If it's lower, then I know I got to get you on the phone or I'm going to have to go out and visit you in person. But making that connection, that's a non-confidential conversation through social media, not on their Facebook wall, but through a direct message kind of thing, has been my compromise. But finding ways to connect and a lot of voice memos, because it's really becoming clear how many of our parents say that they can read and then really can't. The last couple of things when connecting with the community is this overwhelming need that I think that I know that we're all feeling, that there's just not enough. There's not enough, no matter what we do. Like Katie said, the rental assistance was gone within 90 minutes. And honestly, validating to families that we're all in it together. I got sick the first couple of weeks and it really shaped how I approach things now. And just kind of showing like how scary this is, like how, it doesn't feel personal, or it feels distant until it hits close to home. And then it's really, really frightening. But knowing that like I have to pay my rent too, and I have to figure out a way, and just reminding that we're all muddling through. Again, the access to technology. In order to connect with any system, you have to have some form of technology. It's just what we're learning. I mean, that's the way we give updates. As the PEBT information is coming out to school districts, they keep saying that they're going to send a link. That's going to take, it only works if you have a phone that you can click a link to. So figuring out how to cross those, cross some of those barriers. I'm seeing a lot of what my colleagues don't understand in this like motivation start and stop. It's a panic and then they chill. It's a panic and chill. I was out with my coworker visiting a kid today that's been having some chest pains, not COVID-like chest pains, different heart palpitation kind of chest pains. And the family is panicked, so they want to call 911 and then it's forgotten about. And it's trying to, I think it's a big sense of like what the next emergency is. It's a scary time, it's overwhelming. And the last thing that really hit me today, because not necessarily the community I see with revision, but a large part of our community is African American, there's still important things happening in the news. Having these important conversations, talking about safe sex are all things that we still need to talk about in the midst of being safe and social distancing and where to find food and what's going on with schoolwork. And so trying to find that blend for all of our families of pulling out the important information while other important things are still occurring. That covered some of the things that we're looking for. Thanks.
Thanks so much. We'll now move on to a question and answer session. So if any of you guys have questions for any of our speakers, you can submit a question in the question box and we'll moderate the session that way.
And if it's easier for us to unmute you, you could just type, I have a question, and I'll try to unmute you. So we'll try that as well if you don't want to type your question out.
Well, I have a question. This is Padma. One question I would right now there are a lot of overwhelming needs, but is there something from an advocacy perspective that we as healthcare professionals can do? And if so, what area do y'all think is really important for us to be thinking about and focusing on?
I'd be happy to take a stab at that. We've been doing a lot of advocacy. In fact, HILSC put out a set of recommendations that you can find on our website under Disaster Resources for Immigrants. So it's a set of recommendations that we submitted to the city and county for an equitable response and recovery. And it covers all of these issues we've talked about, from food to housing to healthcare. But I think, you know, one thing that we've all touched on is just the need for information. Harris County has done an amazing job, and City of Houston as well, in getting out fact sheets in a variety of languages. So there's a lot of information out there, but in terms of up-to-date, like actionable information, I don't know if any of you are signed up for the city or county's disaster alerts or emergency alerts, but I get a text message all the time when there's something that needs to be paid attention to, when there's when the mask ordinance went into place, or when the parks were closed for Easter weekend, or, you know, different things that are happening. I'm getting updates by text. But these text messages are only available in English and Spanish. And so one of the things that I've been advocating for is to get the emergency alerts in real time in at least the top 5 languages. So I think that's one way we can close the information gap.
I'll jump in as well. I think after hearing everybody speak and sort of my own experiences with taking care of patients, I think the access to internet and telephone is probably a big one that would affect not only our families who have children who can't do their homework and access sort of school assignments, but also thinking from a telehealth standpoint and making sure that our families are able to access appointments. I had a family actually today that we had a video appointment scheduled, but they were not at home. So the quality of their data was not good enough for us to sustain a video appointment. And so sort of thinking about, you know, they went home and were able to access their Wi-Fi, but what about our families that don't have Wi-Fi, right? Are we missing out? We are missing out, I think, on accessing care for some of these families. And so I feel like that could be an important one that would cross multiple sort of areas, healthcare, education, and then just getting them the resources that they need by making sure they're connected.
I fully agree that having access to technology is everything right now. I know HISD, for instance, is pushing to see how many more laptops we can get out to kids next year. And I know that revisions talked about tablets. I don't care what it looks like. It needs to make something that has a camera that can be accessed, it's safety, that you can access emergency care as well as just, you know, to know what's going on in the news and have those appointments.
So we have a question from an audience member. So Betsy's question is, do you know, are there any resources in Spanish to help patients understand and navigate telehealth appointments?
So this is something that we're struggling with. Our clinic specifically, we're using a platform called Doximity for our telehealth. They do have, well, they don't have any information in Spanish, no, actually. It's a fairly simple platform to use, and so we're sort of coaching some of our families through what they should expect as far as getting a text message, clicking on a link, and pop-ups. We also used Doxy.me, another platform, briefly, and that one did have some information from that specific platform on how do you connect to a video call in English and in Spanish. So it's a little bit dependent on the platform that you're using, I think. but there's not much out there in Spanish. So it's really sort of falls on the provider to coach the family through how to access the appointment.
So there's part two of the question, and part two is, do you know the broadband or internet accessibility by race or ethnicity in Harris County? If no, do you know where to obtain that information?
I don't actually. That's a great question. I'm sure that data is out there somewhere. I'm not sure where I would start by looking, but my guess would be that minority patients are going to be less likely to have access to Wi-Fi and broadband. And if anyone else has that information, please share. But I think it's out there, but I'm not sure where exactly to find it.
Thank you. And we have another question from an audience member, Allison. She's asking, there have been mentions that many of these families don't have internet access. Do you know if that includes access to WhatsApp? For context, it's a phone chat application which requires little but some internet data.
I'm able to reach almost all of our families on WhatsApp when I can't do anything else. It's honestly the biggest reason I have a work cell phone, is so that I can do that, because, and that's always been the case. When the school couldn't reach a family to call home, I usually could. So typically, but sometimes it depends where they're at.
Thank you.
So I'll jump in and say that I think WhatsApp is, probably the one thing that families are still able to access. We do some work with a refugee group of mothers, and currently they previously were meeting in person, and now WhatsApp has been the only way that they're able to communicate. They had tried to do Zoom and some other platforms, and WhatsApp is how they're keeping this group in the loop.
Thank you for your responses. We have another question from another audience member, Janet. She's asking, are there any resources for mortgage assistance for immigrants, or would that fall together with rental assistance?
I think that's an excellent question, and it's actually the first time I've ever heard that. So I don't know for sure. I know that the funds that I've heard of always talk about rental assistance, but are certainly worth reaching out to. I would use a United Ways line 211 to answer that question. They'll have a lot more detail about the Greater Houston Community Foundation Fund and the soon to come Harris County Fund. But that's a great question. I'll certainly look into it and post what I find on our resource list.
Great, thank you all for the questions, and also for our panelists for supporting our questions as well. We have about 2 minutes left for our webinar today. I would like to encourage, for any other questions that we have, please enter them in the question box, and we'll be on standby. So general question for our audience. Do we have, are we going to be able to have a copy of your wonderful presentations?
I'd be happy to provide mine to the organizers.
I'm happy to share as well.
Yes.
Thank you.
I have another question, and I think this question, I don't know, this is a hard question. And I think, Sarah, you touched on it a little bit, but how do you go about reaching people who may not have phone service, how do you reach those vulnerable people and patients or our families who may not have cell phone or who may not have technology? How can we connect to those families and get them connected? Sorry, that's a really hard question.
This is the crux of my frustration with this particular situation, because in everything else, after Harvey, things slowed down and we could go out and knock on doors, and Revision has given me the outlet to, the guys, if you will, to deliver food, and I'm supposed to deliver and back away, set it down and step back, quite literally. But I don't have any answer. I guess, honestly, I have done a fair bit of knowing my kids and who they are connected with. And so I'll find one on Facebook and then I'll start asking around, like, have you seen so-and-so? They live in your complex, right? Do you know what's going on? Can you get a message to them? But that's also encouraging them to, not social distance. And so I've done so really carefully, but I think it's a time that social workers and other outreach workers start taking the balanced precaution of knocking on some doors that people were concerned about and linking them back in. But that's a very personal opinion. My boss has a different one. So how I say that.
I'll just add that I think TV and radio is another one from a just general messaging standpoint, not necessarily obviously reaching individual patients that way. But I mean, I've heard a lot of nice messaging on the radio, and obviously on the television and the news locally, talking about, coronavirus locations for testing and reminding people to social distance and practice some of the public health measures.
So now that we're nearing the end of the webinar, I would like to I guess I'll add one last question from our audience member, Dr. Markham. The question is, how can we help the immigrant community feel safe to go to the free testing sites? How can the city or county reassure them that it's safe?
I think that's a really good question. I'm sorry, go ahead. Oh, I was going to say we've actually had a journalist reach out to us about this to talk about like what some of the barriers are, and the bottom line is, given our current state of affairs and just kind of our society in general, immigrants are undocumented people are often afraid to be on any list at all, and so it's difficult to develop trust that this is going to be a safe place. And we've even had this question from a lot of our members of how do we know that that the federal government won't, sue the county to get a list. And so there's a lot of mistrust, and other than emphasizing the need for testing and putting like today's priorities in front of tomorrow's worries, I don't know what else can be done.
I was just going to add that I think as providers we can inform ourselves about what that testing process looks like, make sure that we sort of can at least preemptively give our patients information about, okay, you're going to go here and they're going to ask you for the following information, and this is how the process is going to work. So at least some of it feels more familiar, and maybe they're not showing up and being surprised that they're going to be asked for an ID or, stuff that may incite some fear about some of these things about, yes, their name being on list or things. So I think providing some upfront information potentially could be helpful for some of our patients.
Also, just think for a second, it's scary. Like, okay, you guys can't see me, I realize, but I am a 35-year-old white woman who has, I have citizenship, like there's no question about my payment, I have my insurance, and yet I was scared to get tested. Was it gonna hurt? How was it gonna happen? Who was around me? The doctor who came up to me and was fully, he had his mask, he had his gloves. It was frightening. And so trying to explain to families, also, the test results can be scary because you hear how horrible COVID can be. And so you are crossing your fingers you have the flu. There's the access that's frightening, but there's also if I have it, I'm frightened because there's no medication I'm going to get for it right this moment. And B, if I don't, what is wrong? Like there's just all these other fears that are tied up in it. And so I think that we need to be addressing, I think we do a really good job of talking about how it can be transmitted without knowing. Or without showing symptoms, but just know that there's a lot more. And approaching a testing center where people, one of my friends went and said, look, it was the military who was standing around, that's frightening. And so whether you have, immigrant status or are just, someone born here with no concerns about, payment or anything else, it's an overwhelming process and it's a frightening time. And so I think easing those concerns at the same time is really, really important.
All right, well, thank you all. Thank you all. Thank you, Katie, for being a part of the panel. Also, Dr. Monterey for speaking on behalf of the patients and what you've kind of seen in practice. And thank you as well, Sarah, for kind of joining the conversation and giving us that perspective of community and education perspective. So I also want to thank our attendees for taking your time to visit us today. I will say that we'll be providing a recording. Will be published on our social accounts on Doctors for Change. And I'll be also sending a email with some of these attachments, including the presentation slides that will be shared with us.
Thank you.
All right, so Amanda, I would leave this up for you for closing. If you have anything else to add to the closing, I appreciate you organizing this as well, and to the Immigrant Refugee Health Committee as well for helping put this together.
I think Jorge wrapped it up really well. I just wanted to thank everyone one more time for attending. Thank you for your questions and engagement, and to thank the panelists for their time. I think we had a really great discussion today. So everyone have a nice evening.
Thank you. Bye-bye.